Hello everyone, welcome to Urologist on Air. So we have special conversation with a doctor who is a very prominent and a very popular doctor of all the time. So before starting my questions, I'd like to request you to please introduce yourself to the viewers.
Hello viewers, I am Dr. Abhishek Singh. I am the chairman, Youth Urology Association of India, a senior consultant at Mulji Patel Urological Hospital, India.
Sir, first of all, it's our pleasure to have such a qualified doctor among us. So thank you so much, sir. And starting with the questions, my first question will be related to BPH. BPH is a very common problem. So what are the complications that could develop if BPH is not diagnosed early? Can you share a few instances that you have come across during your practice that may help in educating the viewers?
So let's take it back a little.
Yes.
What is prostate? Prostate basically is an organ that is situated at the mouth of the bladder or neck of the bladder,
Yeah.
from where the urinary tube exits out into the penis and out into the outer world. Around the neck of the bladder, for the first 3 or 4 centimeters of the urinary tube, this is the area which is surrounded by prostate. Prostate is a walnut shaped organ which is connected to another 2 organs which are seminal vesicles. It is basically an accessory sex organ. As the male ages, the size of the prostate increases. Thereby, this prostate causes a compression onto the urinary tube and may also grow into a size projecting into the bladder. This leads to symptoms. What are the typical symptoms? Typical symptoms are decreased urinary flow, needing to get up at night, leaking urine, need to pass the urine urgently, straining to pass urine, and decrease in the stream. There are 2 consequences of a growth of prostate. It may obstruct the flow or it may cause a collateral stress on the bladder which will not allow bladder to store urine in a perfect way. The storage problems would lead to frequency, urgency, and need to pass urine at night. The obstruction will lead to a poor flow, intermittent flow, straining, and decreasing stream. In the market, there are drugs available that can take care of the situation. Typically, the drug that is used for management of this situation is an alpha blocker. The popularly known alpha blockers are tamsulosin, alfuzosin, and silodosin. Well, we are in a Alchem driven activity, so their brand is called the Maxvoid. It's silodosin 8 milligrams to be taken at night with a sip of water. This relaxes the bladder neck and allows you to pass urine well. Another drug known as dutasteride can be added to silodosin. This causes the prostate to decrease in size. Consequently, the patient is able to pass urine well. If the patient is having a lot of storage symptoms, frequency, urgency, nocturia, then you need to add another drug which can quieten the bladder. This drug is called mirabegron.
Yeah.
When you talk about prostate diseases and a patient visits you for these symptoms, it is important that you get a PSA tested for this patient. What is PSA? PSA is prostate specific antigen. It is a chemical test that tells you that the prostate may potentially have cancerous growth. So whenever the PSA is more than 4, you can consider these patients for an MRI. In an MRI, if there is a disease, you consider biopsy. So whenever a patient has these symptoms, though these symptoms are not symptoms of cancer, It gives clinician an opportunity to screen the patient for prostate cancer, which is equally important. If we do not treat the patients with these drugs, there is a potential that the patient can develop infections. The bladder will distend so much that it will fail eventually, and the complete urine will get retained in the bladder. The bladder will become hard, leading to rising pressures and damage of the kidney. It can lead to stone formation, and on a trip, suddenly you can have an acute retention of urine. So these are the problems that can happen if you do not treat this ailment well. If you fail a drug treatment, that means when your clinician starts you on a drug treatment, you are not able to still get desired outcomes in terms of decrease of storage and avoiding symptoms, then your clinician will offer a surgery to you. Well, my parting message to all of you is...
Sir, before parting, I'd like to add one more thing. That sometimes surgery becomes necessary because it cannot be treated with the drugs. So in that case, what can be done and how surgeries can be avoided?
I just alluded to this, that failing a drug therapy, somebody who is not happy with the symptoms, it does not improve in terms of symptoms after taking drugs, then this patient requires surgery. Or if his urine is retaining urine more than 300-400 ml, or he is not able to pass urine even after taking drugs. These are the indications for surgery, and surgery can be done transurethral. That means you put in a scope through your urinary tube, cut the prostate out. You could use a plasma to cut the prostate, or you could use laser to do the same. If the prostates are large in size, you could do an open surgery or a robotic surgery to accomplish the same. Okay, so my parting message to the viewers is that prostate is an organ that every male has. It is going to increase in size as every male ages. So be prepared for it. Visit your urologist, get a PSA testing done, and contact your urologist if the PSA is more than 4. If you have any urinary symptoms, do contact your urologist. Prostate health is equal to a good retirement health. Thank you, viewers.
Thank you so much to all our viewers.